everyone, I'm Dr. Lisa Medaglia, also known as Dr. Lullaby. Today we're going to talk about sleep medication. So as many of you know, I am a behavioral sleep medicine specialist. So as a behavioral sleep medicine specialist, I use a treatment called cognitive behavioral treatment for insomnia to help my patients to improve their ability to fall asleep and return to sleep. Now, with my title, with my background, with my license, I don't prescribe medication. In fact, most people will send me patients to try to help them get off of medication. So what I wanted to kind of do and highlight is when is medication appropriate. So, what we know from there has been an enormous amount of research done in the space of insomnia treatment and done to support the use of cognitive behavioral treatment for insomnia, for management of chronic insomnia. And there's been so much research that's been done that the American College of Physicians released a paper saying that CBTI should be the first line treatment for chronic insomnia. And that only after somebody fails that strategy, fails that approach, should then a sleeping pill be considered. And so, and then that's the recommendation, that's the guideline. My colleague, Dr. Sifu, and I followed up with a paper in JAMA, which you'll see here in your resources, to kind of solidify that news. The issue can be that there are not that many of us that are board certified and formally trained as insomnia specialists to be able to deliver this treatment. So as you guys know, I treat both adults and children. And so to have that board certification on the adult side, I think there's around 300 of us now, and we're filming in 2020. So this is hopefully going to change soon. And I think on the pediatric space, there's less than 30 of us. So only a handful that do both. Because of that, because of access to care, this can be challenging, which is part of why we have Dr. Lullaby available, so that you can learn the CBTI strategies here and so that you can try them out on your own. Now, even with all of that being said, I recognize that many people are already taking sleeping pills. And so that's something that, when they mention their sleep difficulties, their provider already prescribed them a sleeping pill. And so if that's the case, that's okay. You can still benefit from learning the CBTI strategies and trying them out. And what many of my patients do is they're able to taper off of their sleeping pill while learning and trying these strategies. So you may want to kind of work with your doctor, talk to your doctor about whether that might be appropriate for you. So in my clinics, what I tend to do is I work closely with their primary care physician, and we're able to kind of together come up with a plan where we decrease the sleeping pill by 25% every 2 weeks while introducing these behavioral strategies. So we start with sleep restriction and stimulus control, then we go into relaxation strategies, then worry time, then cognitive restructuring, or changing how you think. And so, those techniques and strategies you can see in our lessons here, and you can talk to your doctor about trying that taper schedule while going through those lessons to minimize your chance of experiencing a relapse. If you are taking a sleeping pill, what you don't want to do is you don't want to suddenly stop taking the sleeping pill. If you abruptly discontinue taking a sleeping pill that you've been using on a nightly basis, you will see a worsening of your insomnia, worsening of your sleep difficulty. And if you experience that worsening, not only is that a really hard thing to deal with and cope with, it also kind of just gives you this message that, oh, I can't do it without a sleeping pill, right? Whereas if you gradually taper and you do it in a slow way where you're also going through the lessons and the behavioral interventions, you have a much higher chance of success. So if you are currently taking a sleeping pill, then work with your doctor, talk to them about a taper schedule such as one we just discussed. And if you're not yet taking a sleeping pill, the recommendation is to first try CBTI. Give it a try. Thanks.